everyone. My name is Kelly Jeline, and I'm a marketing director here at Certara. I'm excited to chat with Susan Potts today. Susan joined Certara this year as the head and senior director of biostatistics and data programming. She has 30 years of experience in successful regulatory submissions for drugs, biologics, and medical devices. Most recently, Susan was a senior director of biostatistics at Aglia Biotherapeutics in Austin, Texas. During her tenure there, she built the biometrics department from the ground up, which consisted of biostatistics, statistical programming, medical writing, and data management. Hi, Susan. Great to talk to you.
Hi, Kelly. Good to talk to you as well.
So let's kick things off. Can you describe the size and structure of the programming team here at Certara?
Yes, so we have two different programming teams. Our first team is our PK/PD programmers, and we have 4 PK/PD programmers, and they work directly and interact with our pharmacometricians to build the pharmacometrics data sets that are needed for their population PK analyses, exposure response analyses, and many other types of modeling that help inform drug development for our clients.
Great. And what are the primary services that the programming team provides?
So our PK/PD programming team is, I'm the leader of that team, thank goodness, and it's fun. They're great people, and I've learned a whole new service that Certara offers. There are about 15 to 20 specialist PK/PD programmers spread across the globe. We have a team in Canada, a team in the UK, and then our team in the United States. And then the primary services that we offer are non-mem POP-PK data sets, exposure response data sets, non-compartmental analysis data sets, PK/CDISC standards. So we program the PC, the PP, which are SDTM data sets, and then ADPC and ADPP, which are ATOM data sets that are required for submissions that include pharmacometric data. They also program the TLFs for reporting the results of these pharmacometric analyses. They also perform simulations and produce simulation data sets. And then they QC and e-submission regulatory support. They QC and produce e-submission regulatory data sets for filings.
Perfect. So can you describe the types of studies your team typically supports?
All type of early to late phase studies in any therapeutic area, from oncology to rare diseases, are data sets that we can work on with our PK/PD programming team.
Great. So help me describe the process of working with your team from the time you receive the data to the completion of a project.
Sure. Here are the key steps of our process. We create the dataset spec based on the statistical analysis plan, the protocol, and source datasets. Checking source datasets for data issues, especially exposure and pharmacometric concentration data, is a specialty that we are very proud of. Then we create the data sets based on the data set specifications, who are either put together by the pharmacometricians, the clinical pharmacologist, or the programmers themselves. Then the programming team QCs the data set, make sure that the specifications and the data sets themselves are accurate, and then they send to the modeler for further review. The modeler will, let them know that there are additional covariates they might want to have included. So then the programming team finalizes the data set based on those comments from the modeler. They are flexible to accommodate reasonable changes from the sponsor that won't jeopardize timelines. And even when it is something that might be considered a bit unreasonable, they always come through. They're an amazing group of individuals.
That's wonderful. So in general, how does the programming team integrate with the pharmacometrics team?
The pharmacometrician is the lead of the project and guides the programming team as per the requirements. The programming team works hand in glove with pharmacometricians to ensure that the data sets that are programmed meet the modeling demands. We have the best programming team and best pharmacometricians in the world. Our team members are located all over the world and with various backgrounds, so we are capable of working for any project all over the world with high efficiency and best quality. We work as one team. Any finding, especially the data issue or queries, will inform the pharmacometrics team, and then they can take action immediately. Meanwhile, the pharmacometricians will communicate with the programmers for any new requirements or changes, which often come through when we work with our clients.
Great. So now let's talk about Certara's biostatistics services. Can you describe the biostats group at Certara, the size, the structure, and their experience?
Sure. Our biostats and programming team consists of 5 biostatisticians, 4 of whom have over 20 years of experience, and 4 statistical programmers with approximately 10 or more years of experience each. The services that we provide, the programming team programs all of the data sets and tables, listings, and figures for each clinical protocol that we work on. The first step is typically working with our laboratory vendors, such as our safety labs or pharmacometrics labs, to provide the data to us in a structure that we can bring in and use programmatically. And then they also author SDTM and ATOM dataset specifications and program those datasets by following the specifications themselves. These are required for regulatory submissions by the FDA. Other regulators around the world don't yet require those types of datasets, but we feel it'll be coming soon thereafter. They also program the tables, listings, and figures that are specified in the statistical analysis plan and the TLF shells, both of which are authored by our biostatisticians. The last step for the study programmer is to program the SDTM and ATOM defined packages and reviewers guides, which are essentially roadmaps to the data that regulatory authorities need during their review of submission data for a new drug application. Our programming team also support annual safety updates, investigator brochures, and safety review committees by programming the necessary outputs. Our statisticians participate very early on in the actual study design. And the earlier the better is how we always feel that we should be included. That doesn't always happen, but if it does, then we are influential in choosing the actual study endpoints as well as the analyses of those endpoints. We also write the statistical section of each protocol, which includes sample size calculations, the power calculations, as well as all of the analyses that will be performed for each of the endpoints. We participate in case report form design and review, which is where we actually collect the data that are specified in the protocol. We can help with randomization. We can either program the randomization schedules for a randomized clinical trial, or at least review the randomization schedules if someone else is tasked with that randomization schedule generation. We then author the statistical analysis plan and the TLF shells, which, as I said earlier, is the roadmap for our programmers. We review data for consistency and scientific integrity. We have an internal critical review of the programmed tables, listings, and figures that the programmers produce to ensure they are accurate and reflect what was in the actual statistical analysis plan. We then generate a top-line PowerPoint presentation so that the folks at the sponsor can actually take that presentation and share that with their chief executive officer, any analyst, or anyone else on the board of directors to help them understand the outcome of the study. We then produce the final tables, listings, and figures, which are provided to the author and of the CSR, which is a clinical study report. We can, along with the programmers, also support data safety updates and investigator brochure support. We also can be either a participant, a voting member, or the actual data safety monitoring board statistician for teams that actually review the safety data and let the company continue to move forward with development of their molecule. We also provide regulatory support by writing briefing books, meeting with the actual agency themselves, and then preparing and following up with the minutes.
Wow, that's quite a list.
It is quite a list, and it's probably really long, but I wanted to make sure we got in everything that we are able to do.
That's wonderful. So to you, what makes our biostats team unique?
We all have a great deal of experience. Actually, several of us have worked together in the past, so we are already well integrated and very used to working with each other. And then actually very selective with the team members that we add to our team to ensure that we all continue to be cohesive and really get along really well and understand the needs of each other. So it's great.
Good. So let's switch to more of a personal level. So what do you love about working at Certara so far?
I love the people I work with as well as the independence I have as a consultant. We're highly encouraged to pursue the career that we want to have by taking on new and exciting projects that we are interested in. Also, as you can tell, I'm in our RV, so this allows me the opportunity to travel with my husband, and I can work in the RV while he's off in his business meetings. So it's great.
That's great. That's the definition of flexibility.
It is.
So tell us about your career journey and how you ended up here in that RV today.
Okay, so I started out with a career, with my degree in biostatistics from the University of North Carolina at Chapel Hill. And from there, I was offered an opportunity with Alcon Laboratories in Fort Worth, Texas, where I worked for 19 years in multiple therapeutic areas and with lots and lots of different regulatory groups. From Alcon, I then went to Endo Pharmaceuticals, which is located just outside Philadelphia in Pennsylvania. I was there for about 3 years and then was offered an opportunity to come back to my home state of Texas, where I started a career with Reata Pharmaceuticals. Unfortunately, their primary molecule was halted by a data safety monitoring board. So at that point, I started looking for other opportunities. And I found Statistics and Data Corporation out of Tempe, Arizona, where I was also allowed to work remotely. It was a fabulous 5 years that I was with them. And then I was starting to kind of really miss being on the pharma side. So I joined a small company named Aglia Biotherapeutics, where I was the head of their department and grew that same department by, as you indicated earlier, medical writing, stats programming, and data management, which is the vision that we have here at Certara as well. And then I was fortunate enough to join Certara last December. So I've been here almost a year and just love everything about it.
Wonderful. It's quite a career. So finally, what are your favorite parts of your job here?
To be honest, the favorite part of my job is building a cohesive stats and programming team from very unique and highly diverse individuals who work incredibly well together. That's something that's really important to me, is to ensure that everyone on this team, enjoys working with everyone else on their team. And sometimes that's not an easy task, but thankfully I've had the opportunity to work with some incredibly talented individuals. And we have built such a team.
Wonderful. Well, thank you so much for chatting today, Susan. It's really been a pleasure.
Well, thank you. I've enjoyed it.